The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
We go now to our reporter, Laura Windsor, who has more on treating drug and alcohol addiction.
What does someone do when they have a drug or alcohol addiction? We spoke to Dr. Karen Hylen, a primary therapist at Summit Malibu. We asked Dr. Hylen, what is the process for treating patients with a drug and alcohol addiction?
We begin our treatment at Summit by having a complete psychiatric evaluation. Very often someone does have an underlying, what we call a dual diagnosis. There is an emotional problem, perhaps anxiety, depression. We're seeing more and more bipolar disorder. So it's so important initially to know who we're treating, what is their suffering. So that's where it begins. Followed by a medical examination, because very often someone has a physical illness that actually started the taking of drugs, something like Vicodin, and they've become addicted. What we also do is we start our treatment if somebody comes in under the influence, has not detoxed from their medication, then we do a full detox, medical detox.
We asked Dr. Hylen what is her process for treating patients for drugs and alcohol.
The first thing I do is I too will take a psychosocial assessment, so I get to know their social environment, go back over childhood. But then I give them an assessment which actually identifies what are called maladaptive schemas, which are distorted beliefs about themselves. If they have a maladaptive schema such as defectiveness or feeling like they're a failure, that someone is going to abandon them at some point, then what's going to happen, their thinking is going to be consistently moving toward that painful thought. And so it's so important to be able to identify these for the client. There are two sets of skills that are all about acceptance. The core skill of mindfulness, as well as the skills module of learning how to tolerate distress better. And then the two skills that help with change are interpersonal effectiveness, our ability to ask for what we want, say no in an effective way that is both respectful of self and other, and also emotion regulation. How do we deal with these mysterious things called emotions? I like to say we give our clients a toolbox with which they can leave treatment and function in the world in just a healthier way than they've ever been able to do before, a much more adult way.
Dr. Hylen, what is your advice for someone who has an addiction problem?
Addiction really is a family disease, and once they realize that unless they choose never to drink or use drugs again, the disease is going to be progressive, and what the wreckage they're looking at now is nothing compared to the wreckage that will await them if they continue on what I call a death-oriented path, the path of addiction, and choose the life-oriented path of becoming fully conscious in the moment of their choices. And choices are a big thing. I like to say what we gain through mindfulness is freedom. We have the freedom to guide the mind in a way that it's working for us in the way we want it to work, because it's getting us one step closer to that life worth living.
If you or someone you know is addicted to drugs or alcohol, make sure you seek professional help so you can enjoy a happy and healthy life. For the American Health Journal, I'm Laura Windsor.